Cameroon starts world's first malaria vaccine program for children. Cameroon will be the first country to routinely give children a new malaria vaccine as the shots are rolled out in Africa. This is reported on the 22nd of January 2024. The campaign, which is due to start on Monday, which is the 29th of January, was described by officials as a milestone in the decades-long effort to curb the mosquito-spread disease on the continent, which accounts for 95% of the world's malaria deaths. The vaccination will save lives. It will provide major relief to families and the country's health system, according to the Chief Programme Officer at the Gavi Vaccines Alliance, which is helping Cameroon secure the shots. The Central African nation hopes to vaccinate about 250,000 children this year and next year. Gavi said it is working with 20 other African countries to help them get the vaccine, and that those countries will hopefully immunise more than 6 million children through 2025. In Africa, there are about 250 million cases of the parasitic disease each year, including 600,000 deaths, mostly in young children. Cameroon will use the first of two recently approved malaria vaccines. The World Health Organization endorsed this vaccine 2 years ago, acknowledging that even though it is imperfect, its use would still dramatically reduce severe infections and hospitalizations. The shot is only about 30% effective. It requires 4 doses and protection begins to fade after several months. The vaccine was tested in Africa and used in pilot programs in 3 countries. The company GSK, who produced the shot, has said it can only produce about 15 million doses a year, and some experts believe a second malaria vaccine developed by Oxford University and approved by the World Health Organization in October might be a more practical solution. That vaccine is cheaper, requires 3 doses, and India's Serum Institute said they could make up to 200 million doses a year. The Chief Programme Officer at the Gavi Vaccines Alliance said they hoped that there might be enough of the Oxford vaccines available to begin immunising people later this year. Neither of the malaria vaccines stop transmission, so other tools like bed nets and insecticidal spraying will still be critical. The malaria parasite mostly spreads to people via infected mosquitoes and can cause symptoms including fever, headaches and chills. So this is a promising start. The world's first malaria vaccine program for children. Why is it taking this long? But anyhow, I'm not going to take away from it. It's amazing. It's wonderful. It gives us hope. Malaria, isn't it one of the biggest killers in the world, or possibly the biggest? Oh, it's so sad. But hopefully this will work. The Oxford vaccine will come in, and whilst it won't be a cure, it will help people. Even if you still catch malaria, maybe the vaccine will help you cope with it better. A bit like any other vaccine, you still may get the illness, but it just won't be as bad. That's what the vaccine's for. Vaccines aren't necessarily to cure. They are to treat, to manage. Side note, whilst we're talking about vaccines, millions in the UK are being urged to get vaccinations during a surge in measles cases. Fewer people have been vaccinating their children against measles, the MMR vaccine, due to some fake science that was put out there a few years ago, and now measles is coming back. So do your research, get vaccinated, get this country back to being almost measles free. You know, why do you want your child to get sick? I don't understand. But anywho,